So, good morning, ma'am. I am Rachel Ibarra and I will be your student nurse for today. But before we start, may I ask your name and date of birth?
My name is Rhea Ibarra. I am born in September 25, 2004.
Okay. Okay, thank you, ma'am. So, I will be assessing your mouth, throat, nose, and sinuses today. So, we are doing this to ensure that everything is normal, and if there are any abnormalities, we want to note that for further evaluation to avoid further complications. So, you will be remain seated throughout the assessment because we only want to examine your head, specifically your mouth, throat, nose, and sinuses. So, the results that we will gather from you today will help us establish a nursing diagnosis and plans of care and make clinical judgment about your health status. But rest assured, ma'am, that all of the informations that we will be noting from you today will remain confidential, and only those authorized healthcare professionals can see your informations. So, will that be okay with you, ma'am? Okay, thank you. So, before we start, may I ask if you have any history of the following? So, do you have any pattern of dental care? So, what is it, ma'am?
I brush my teeth 3 times a day.
Okay, thank you, ma'am. So, when is your last visit to a dentist?
Last month.
Okay, for what, ma'am?
For cleaning.
Okay, thank you, ma'am. So, have you ever experienced ulcers or lesions in your mouth? So, what is it, ma'am?
Singaw po.
Okay, so how long does it last?
1 week.
Okay, thank you, ma'am. So, do you wear any dentures? Like pustiso po? No? Okay. So, are you receiving any medications? No? Okay, thank you. So, thank you for that information, ma'am. So, but before we start, may I ask if you are comfortable with your seat? Okay, thank you, ma'am. So, do you have any questions before we start? Okay, but if you do have, you can freely ask me throughout the assessment, okay? Right. So, after preparing the client, we can now move on the first part of our assessment, which is inspection. So, first, we will inspect first the lips of our client for its color and consistency. So, my client's lips have a color ranges from light to dark pink. It is smooth and moist without any lesions or swelling. So, next I will inspect your teeth and mouth, ma'am. So, can you open your mouth? Wider, ma'am. Wider po. Okay, thank you. So, yung taas po. Okay. 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 So, I'll just count your teeth lang po, ma'am, ha? Upper po. Okay. So, as I have inspected, my client have 28 teeth, 14 on the lower arch and 14 on the upper arch. Their color ranges from white to light yellow and with shiny enamel and smooth surfaces and edges. So, normal number of teeth, ma'am, is 32, but your 4 wisdom teeth still do not erupt, so 28 is just normal. So, I have also inspected that there are 2 crowded teeth on your lower arch and 1 on your upper arch. But you don't have to worry about it, ma'am, because braces can fix it. So, lastly, ma'am, I have observed that your teeth is still in good condition. There are no decayed areas and there are no missing teeth. So, I have noted that my client doesn't have any appliances on her teeth such as braces, and there are no evidence of repair work on her teeth such as fillings, crowns, or cosmetics such as veneers. So, moving on, can you bite down your teeth, ma'am, like you're chewing on something? Okay. So, I have observed that her jaws are aligned with no deviations with biting. Next, I will check your gums. So, I will just wear my gloves, ma'am. So, okay, ma'am. I just wear my gloves, ma'am. Can you open your mouth, ma'am? And I will now retract your lips and gums. Okay. Now on the other side. Okay. So I have inspected that the color and consistency of tissues along your cheeks and gums are even, which is good. So next, I will inspect your buccal mucosa, ma'am. So just relax your mouth, ma'am. So I will just use a pen light and tongue depressor to retract your lips and cheeks, ma'am, for its color and consistency. So relax your mouth, ma'am. So can you open your mouth? Okay. So I'll just retract. Okay, your buccal mucosa. Okay. Oh, okay. Okay, so as I have inspected, the tissues on your buccal mucosa appears moist and pink. They are soft and pliable on palpation, and your stents and ducts are visible with flow and saliva. So there are no redness, swelling, or moistness in the area. So next, I will going to palpate your tongue, ma'am. So can you just open your mouth? I will just inspect for its color, moisture, size, and texture. So stick out your tongue, ma'am. Ayan, okay. Thank you, ma'am. So can you stick out your tongue, ma'am? Okay. So can I palpate it? Okay, thank you, ma'am. So, as I have observed, you have pinkish, moist, moderate size with papillae present and slightly rough tongue. So, there are no presence of any lesions and fasciculations on your tongue, ma'am. So, fasciculations po on the tongue are visible spontaneous and intermittent contractures of muscle fibers that are often a neurological findings of concern. So, reportedly po related to motor neuron disorders. Luckily, I haven't observed that po on your tongue. So, if you have seen lesions on the tongue of your client, palpate it for indurations. So, indurations means hardness. So, I will just observe the ventral surface of your tongue, ma'am. So, can you just stick out your tongue to the roof of your mouth? Okay. Stick out, ma'am. Okay, so lapit ko po. Okay. So, as I have inspected, you have prominent veins on the ventral surface of your tongue. It is slightly pale to pink. It is smooth, moist, and shiny and free from lesions. Your frenulum is midline. Lastly, the area under your tongue is pink, smooth, moist, and shiny, which is good. So, I will just inspect your Wharton's duct, ma'am. So, can you open your mouth? Okay, thank you. Okay, so your Wharton ducts are visible, and there are also flows of saliva and there are also salivary flows and moistness in the area. So there are also no swelling, redness, or pain, which is good. So next, I will observe the sides of your tongue, ma'am. So I will just use this gauze pad to hold each sides of your tongue po. So can you stick out your tongue? Okay. So I'll just hold it here. Okay, on the other side. Okay, so thank you, ma'am. So I have observed that your tongue has no lesions, ulcers, or nodules that are apparent, which is good. Now, can I touch your cheeks, ma'am? Okay. Okay, so I'll just apply pressure on your cheeks and then resist it with your with the tip of your tongue, ma'am. So just resist the pressure from my fingers. So first. Okay, on the other side. Okay. So, your tongue offers a strong resistance, which is good. So, next, I will sprinkle something on your tongue. Then, tell me how does it taste. Okay? So, I will sprinkle something on your tongue. So, say, ma'am. Labas niyo po yung dila niyo. So, I will just sprinkle it here on the sides and tip of your tongue. Tip po. So, ilabas niyo po yung dila niyo. How does it taste, ma'am? Is it sweet or salty?
Salty.
Salty. Okay. So, next, ma'am. Can you open your mouth, ma'am? Your tongue, ma'am? Can you stick out? Okay. So, how does it taste, ma'am?
Sweet.
It's sweet? Okay. Thank you, ma'am. So, you are right, ma'am. That means you can distinguish taste between sweet and salty, which is good. So, if you have tongue blades, you can place a drops of sweet and salty water on the sides and tip of your client's tongue. So, next, can you open your mouth, ma'am? I will just inspect for your hard and soft palate. So, can you, and then open your mouth. Okay. Okay, ma'am. Okay, so I have inspected that your hard palate is pale or whitish with transverse rugae or wrinkle-like folds. Your soft palate and uvula are pale or whitish. Its surface is intact, movable and smooth. And I also don't see any lesions. So I have also noted that you don't have unusual or foul odor, which is good. So next, I will assess your uvula and we will note for its character and positioning. So I'll just stick this tongue depressor on your tongue, ma'am, and I will shine a pen light on your uvula. So can you open your mouth? Okay, I will stick. Can you relax it? Can you open your mouth? Relax your mouth, your tongue, ma'am. Okay. Ma'am, ipaharap. Okay, so ganun pa po para makita ko mabilis. Okay, so what is uvula, ma'am? Uvula, ma'am, is a fleshy, solid structure that is that hangs freely in the midline of your mouth. So I have observed that there are no redness or exudate that are present in on your uvula. So which is good. So, can you say, I will just inspect, and can you say, ah?
Ah.
Once more?
Ah.
Okay. Okay, so I have observed that the elevation of your uvula is midline and the elevation of your soft palate is symmetric. So, next I will going to inspect your tonsils. So, I'll just place this tongue depressor on your tongue, ma'am, to make your, and make your mouth wide open. Okay? We are halfway done. Okay. Okay. So, can you know, that's wide open. Oh, okay. Very good, ma'am. Okay. So, I have observed that your tonsils are pink and symmetric, and they are enlarged to 1+, which is just normal. So, in addition, I also don't see any presence of exudate, swelling, or lesions, which is good. Next, I will observe abnormalities on your throat, ma'am. So, can you open your mouth again? Okay, just relax your mouth, ma'am. Open it wide. Okay, so I have observed that your throat is pink without oxidate and lesions, which is good. So now we will move on to the inspection and palpation of your nose, ma'am. But before we move on, I'll just remove my gloves. Okay. So I have changed my gloves, ma'am. So now we will move on the inspection and palpation of your nose, ma'am. So first, I will inspect and palpate your external nose. So tell me if you feel any tenderness. So here. So do you feel any tenderness, ma'am? No? Okay. Can we see, ma'am? Okay. Okay, so I have inspected that the color of your nose is the same as the rest of your face. So, and your nasal structure is smooth and symmetric. And my client also reported no tenderness. So, next I will block one of your nostrils. So, is it okay to you if I touch your nose, ma'am? So, I will block it and then you need to sniff. So, I will block it, ma'am. So, sniff. Okay, on the other side. Okay, so my client is able to sniff through each nostril while other is occluded, which is good. So next, ma'am, I will inspect your internal nose. So to inspect the internal nose of the client, you can use an otoscope with short, wide tip attachment, or you can use nasal speculum or your fingers and with gloves and a pen light. Okay, so I'll just observe your nostril, your internal nose, ma'am. So, okay. So I have observed that my client's nasal mucosa is dark, pink, and moist and free from oxidate. The nasal septum of my client is intact and free from ulcers or perforations. In addition, her turbinates are dark, pink, moist, and free from lesion. Lastly, her superior turbinate is not visible on my point of view a while ago, which is just normal. So finally, we will now move on the last part of our assessment, which is the palpation of your sinuses. So first, I will palpate your frontal sinuses. Tell me if you feel any tenderness. So I'll just palpate your frontal sinuses. So do you feel any tenderness? So next, I will palpate your maxillary sinuses. So do you feel any tenderness? No? Okay. So the frontal and maxillary sinuses of my client are non-tender to palpation and no crepitus is evident. So next, I will lightly tap over your frontal and maxillary sinuses. So tell me if you feel any tenderness, okay? Do you feel any tenderness? Okay, so the sinuses of my client are not tender on percussion. So lastly, ma'am, I will shine a light on your sinuses. So I will just darken our room. So give me a minute, ma'am. So now that the room is dark enough, I will now shine a light on your frontal sinuses. So first on the right, frontal sinus. I'll just shine a light. Okay, now on your left frontal sinus. Okay, so it's visible. Now on your maxillary sinus. First on the right. Okay, on the right. Okay. So can you open your mouth, ma'am? Okay, just open your mouth. I will just shine a light on your maxillary sinus. Okay, so now on your left maxillary sinus. So just open your mouth, ma'am. Okay. 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 And okay. So I have observed that the light shine through your tissues and it appears as a reddish glow over your sinuses, which is good. So now, ma'am, that is the last part of our examination. We are now done with the assessment of your mouth, throat, nose, and sinuses. So after the assessment, we can now document all our findings and remove all our PPEs. Thank you.